Hi, hello, welcome back to our channel. So today we are going to see about how to place the rubber dam to your teeth. So before going into the video, please do like the video and share the video and never forget to subscribe. Let's go into the video today. So before starting to place the rubber dam, let's see what are the instruments we have to place the rubber dam. So first one is we have the punching machine where it is similar to the paper puncher, but we have different hole sizes. It depends on how much size is the tooth, and we have to adjust the size, and we have to punch it towards your rubber dam. So we have to place the rubber dam in this way, and we have to measure it where it comes, and we have to put the hole, and with that hole only the tooth will be isolated. And for isolation, the frame is very important, because if at all the frame is not there, it is not a proper isolation, right? The saliva will be flowing into this rubber dam and disturbing our treatment, right? So we have to place the frame in this way, and we have to be so much concerned that the sharp edges are not disturbing the patient. So we have to conceal the sharp edges with the rubber dam and close it, so it is not moving, and along with it the sharp edges are not disturbing the patient also. So along with it we have clamps. So the clamps are like different sizes, so we have to choose the clamp before placing the rubber dam. So we have to first choose the clamp, and then we have to keep it aside, and then punch a hole in the rubber dam, and we have to place the rubber dam to your tooth. So we have different sizes in the clamp also. And to carry the clamp we have a instrument. So this instrument only is going to carry your clamp inside your mouth. So this is going to be very much useful, because we have an adjustable flip here, so we can lock your instrument at any size you want, and we can use it to carry your clamp to your tooth, and it won't get displaced from your instrument. So come, let's go and watch how to place the rubber dam. So first we have to select the clamp size. So initially we have to try 2 to 3 clamps to your tooth at the cervical region where it is getting plugged into, and we have to check for the size. If it is smaller, it is meant to be for the anteriors, and if it is a bigger size, it will be fitting in the molars. So the first tried clamp is like for the premolars, and the next one is for the molars. So this is exactly getting clamped to your cervical region, right? So we are using this clamp for the rubber dam. So this is the rubber dam. We have to first measure the we will be having a template for this, and we can get that template and get the markings on the rubber dam and go for the punching. So we have to alter the punching machine, and then we have to move the rubber dam to the marked position, and we have to punch the hole. So yes, we are punching the hole for 3 to 4 tooth, and we can do for a single tooth also, but mostly we will be isolating as a group, as like 2 to 3 tooth together, or we can do a separate one single tooth isolation also. So we have to put the clamp inside the hole, and we have to clamp it to the tooth, and this will prevent the saliva to oozing out in the margins. And we have to go with the other tooth also. It is better to go with the probe. As I don't have the probe at present, I'm using my hands to do it, so it is better to go with probe to adjust into the tooth. And it should be like, you can use floss also to get the rubber dam inside the interdental space. And what we have to do is we have to remove the clamp edges which is attached to the rubber dam, and we have to completely isolate the region. So similarly, we have to remove the rubber dam from the clamp, and we have to adjust it towards the tooth. And it is very important to clamp the rubber dam to your cervical region, because if you are doing it in halfway through it will get slipped off and it will get removed when you are framing it. So it is better to go for the cervical region to get the clamp to. So we have to place the rubber dam in this way and not in this way. It should not be like this. The frame should not be like this. It should be like this. The frame should be like this. So after placing the rubber dam, we have to introduce the frame. So this is one method, and the other method is we have to clip the rubber dam to the frame, and then you have to introduce the clamp with that to the tooth. So this method also is easier. Or so this is another method where we are plugging the rubber dam to the frame first. It should be tight enough and get engaged all the way, and we have to engage the clamp to the hole which we have punched, and we have to place it into the tooth. So this is much more easier for the patients. So we have to again clamp it to the cervical region and then pull out the other tooth through the hole with the help of the probe. So as I'm not having the probe, I'm doing it in freehand. It is better to go with the probe, which is much more easier for you to adapt it to the cervical region. And for interdental space, you can use the floss as I said before, and you can just isolate it properly. So both are correct, both methods are acceptable. So which is easier for us, we can choose that method and we can do practice it. And if you have any doubt, you can just ping me in the comment box. So do like and share the video, and much more videos are coming for you.